Lymph nodes, also called lymph glands, play a vital role in your body's ability to fight off infections. Dr. Behnam Ebrahimi, specializing in internal medicine at Pomona Valley Hospital Medical Center, discusses what can cause swollen glands and when to seek medical attention.
Swollen glands, I would say the most common causes would be infection. They could be either viral, bacterial, or fungal. What I do for a living, this also could be from cancer. The most common would be infections. Most of us know about the glands in the neck. It could be behind the ears, it could be in the armpits, in the groin. Essentially, we have lymph glands all over our body, so those are the ones that we can feel, but you have lymph glands within your chest, within your abdomen, and again, the lymph glands are there so they can fight off infections or cancers, and they get swollen, they have lymphocytes in there, but you have lymph glands all over your body. You can have a swelling of the gland that basically your loved one notices or you notices while you're shaving. There's no pain associated with it, but it could also be a sign of something serious.
When should someone seek medical attention for swollen glands?
You start getting concerned if you waited 2 to 4 weeks and it hasn't got better. A lot of times, especially if you don't have symptoms, up to 1 centimeter lymph node is considered normal. And then the bigger the lymph node is, then the more concerned you get, especially if it grew very fast. Let's say, over 1 week it triple in size. I think then you wouldn't wait. But if it's a small lymph node, let's say less than a centimeter or a centimeter to 2, you don't have symptoms, you can probably just observe it. A lot of the times it's just like an infection, and it gets better. Infectious mono, which is the Epstein-Barr virus, especially in kids, but also adults, can cause a swollen lymph node, and that basically means your immune system is working. So just because it's just like fever, having high fever or a big lymph node means your immune system's actually fighting that infection, so it's not a bad thing.
There are a range of treatments for swollen glands based on the cause.
If it's a viral infection, there's no treatment for that. Bacterial infections, you would get antibiotics. If it's a cancer, most common cancers will be, depending on the location, lymphoma, leukemia. Of course, you do treatment for that. Chemotherapy, radiation therapy. There are certain medications that can cause a big lymph node, and like, for example, the anti-seizure medications. And if that's the case, it's very rare. You obviously hold those medications.
Dr. Ebrahimi outlines some warning signs of swollen glands.
The warning signs: drenching night sweats, fevers of 101, chills, weight loss more than 10%. These are sometimes signs of cancer, so you want to be aware of that. If the lymph node doesn't get better, I think wait 2 to 4 weeks in adults. If it's still enlarged and it keeps getting bigger, I think then you want to go see the doctor, and then depending on which location it is, then the doctor might treat it. But I think just because you feel a lymph node, it doesn't mean as long as you're doing fairly well, you don't have any symptoms, you can just observe it.